Our first segment is on chest pain, something that shouldn't be ignored or taken for granted. To explain, Dr. Jairo-Marin of St. Joseph Hospital in Orange.
Chest pain center is meant for the acute management of patients with chest pain, which could be due to the heart and not due to the heart, and it's very important to differentiate them. Is it chest pain from the heart, or is it chest pain not from the heart? If it is from the heart, it needs a very rapid diagnosis, rapid management and treatment of the pain, because if you are having pain that is due from your heart, if you're having chest pain that is due to your heart, the less time you waste, the more the patient is going to benefit. There's a saying, and everybody knows this, is time is muscle. If you're having a problem with your heart, muscle is dying. The more you wait, the more muscle will die. So this chest pain center is specifically to treat patients with chest pain and to determine if they need an acute intervention, if they need management of this discomfort as quickly as possible. The chest pain center is actually in the emergency room, but the chest pain center is the whole hospital. The patients come into the emergency room. We have a very, very well trained, around the clock, fully equipped emergency room staff, and we have a dedicated nurses to manage just the patients with chest pain. We have set beds for them in the emergency room where they can be kept in there and not have to be admitted to the hospital unless they need to be admitted. We have, I say it's the whole hospital because we have 24-hour interventional cardiologist that is available for the management of these patients. We have 24-hour around-the-clock access to cardiovascular surgery should they need cardiovascular surgery. We have 24-hour access to non-interventional or non-invasive diagnostic tests for these patients, such as stress echocardiograms, dobutamine echocardiograms. The chest pain patients are divided into 3 different categories. Those that are actively having a heart attack. They're having chest pain. You look at the EKG shows they're having a heart attack. Those patients get treated very aggressively. The second category is patients that are having chest pain, but the EKG does not show typical findings consistent with a heart attack. The third type of patient, which is actually the most common, is the patient that comes in with chest pain. A lot of times the pain is resolved by the time they come to the emergency room. By the time they get to the emergency room, they no longer have pain. They're feeling fine, but they come in to get checked. The EKG is completely normal, or it doesn't show that the patient is having any type of a heart attack. We evaluate them. The interventional cardiologist will evaluate the patient. If the interventional cardiologist feels that the history is typical for unstable angina, in other words, the pain is due to the heart, but you're not having it right now, the patient gets stabilized with aspirin, with heparin, with nitroglycerin. They get put in the unit, and the intervention or the diagnostic test, the heart catheterization, can be done electively, say the next morning. It doesn't have to be done right within that particular time. If the cardiologist feels that the chest pain is not quite typical for heart pain, it may be, it may not be, then what we do is we treat them with aspirin, we put them on oxygen, we put them at bed rest in the emergency room, and we get blood tests. If the blood test, which checks for heart damage or heart enzymes, if the blood tests are negative, we'll repeat them in 4 hours. If we have 2 blood tests that do not show that the patients had any heart damage in spite of all that chest pain they had, then we immediately do a stress test. If the stress test is abnormal, obviously it's your heart. You'll stay in the hospital, you have an angiogram. But if the stress test is normal, then your heart is fine, you can go home, and they can evaluate the chest pain as an outpatient. And we have saved the patient and the insurance company and the hospital unnecessary hospitalization. Within 6 to 12 hours, we'll have an answer for you. And that is a benefit of the chest pain center.